Now we're going to look at the lower veins of the cat. So in order to see those, I have to first move the internal organs out of the way. So I move the intestines here, and I move the stomach here and the liver. I move it all out of the way, and I can see the kidneys right away. Here I see some pancreas, and I move that out of the way. And I see the kidneys. And I see this big vein coming down here above the kidneys, this here. And this is the inferior vena cava. It's also called the posterior vena cava in the cat. And here I can't see where it feeds the heart because it goes up behind the organs. And I also cannot see the hepatic vein. Here's a piece of the liver. And cats have several hepatic veins that join together and then join the vena cava here, the inferior vena cava, but I can't see them. So I follow the inferior vena cava down, and I can see right away the renal veins. So here's one renal vein and the other one. And above the renal veins are the adrenolumbar veins, and here I can see one. And again, there's a right and a left. Here's one here. So the adrenolumbar veins come off in pairs. This one is kind of attached. And the adrenolumbar veins drain blood from the adrenal glands, which are just above the kidneys, and from the lumbar region. So the renal veins and the adrenolumbar veins. And then continuing down, I should see the gonadal veins, the spermatic or ovarian. And again, there's a left and a right, but these are broken. It's maybe this is a spermatic or ovarian vein, but I wouldn't count on it. So I don't really see those well here, but I do see a beautiful iliolumbar vein. So again, these are left and right, and I can see that the left side is broken. But here's the right iliolumbar vein, which goes to the ilium, drains blood from the ilium and from the lumbar region. And now, this is always called the inferior vena cava, and now it splits into two. And after this split, each one of these are called the common iliac veins. So I have a left common iliac and a right common iliac. So now this is different from the arteries. We don't have common iliac arteries. Humans do, but cats do not. And then coming off quickly, a small vein going down deep, and this is the internal iliac. So the common iliac, right, this inferior vena cava splits into the two common iliacs, and then the internal iliac comes off, and now the vein is called the external iliac. Okay? Then this is the external iliac. So it's the common iliac, and then the internal iliac comes off, and then it's the external iliac. And now I see it better here on the left side. So again, I see the common iliac and the internal. I don't see it as well here. This looks like it. And then the external iliac. And then coming off the external iliac further down is the deep femoral. So this is the external iliac. Get under it. This, the external iliac. And then the deep femoral comes off, which I think is this. Right? The deep femoral, because it goes towards the inside. And once the deep femoral comes off, then the external iliac now here is called the femoral artery. So first it's the common iliac, then it gives off the internal iliac, which is here. Then after it gives off the internal iliac, now it's called the external iliac, and then it gives off the deep femoral, which is this. And then after it gives off the deep femoral, then it's called the femoral vein. And now the femoral vein splits into three, really nice, here. And here you can see two, and the third one goes kind of deep. You can see the third one down in there. There it is. So the first, the two outside veins both begin with an S, and one goes towards the knee, and that is the superior articula. So articulation goes towards the knee. And then the other one that goes towards the inside is the saphenous vein. And then this one that goes deep and continues is the popliteal vein. The popliteal. So remember that, like the top of the body, the veins are actually bringing blood towards the heart, not away. So it's a little misleading the way we describe it, because really the blood is going into the saphenous and into the superior articula and into the popliteal vein, and they're coming together to form the femoral vein, and blood joins from the deep femoral, and now it's called the external iliac, and then blood joins from the internal iliac. Where is it? There it is. And then it's called the common iliac, and then it joins with the other common iliac into the inferior vena cava, and then blood joins from the iliolumbars, from the gonadal, spermatic, or ovarian, from the renal veins and the adrenolumbars, and then from the hepatic vein. And then this inferior vena cava joins the right atrium. And those are the lower veins of the cat.